Hello, student nurses and midwives. A good afternoon to you all. You're very welcome for this session. And today we are here to proceed with our foundations of nursing. I'm Zawede Hawa by NANS, part of the blended learning team. And today we are going to be looking at hospital economy, okay? Hope everyone is doing well and ready for the session. So we are going to start off with our learning objectives for this lesson. And by the end of this lesson, a student should be able to 1. Define hospital economy. 2. To apply hospital economy in nursing practice. 3. To explain the importance of hospital economy. So these are going to be our objectives, and I expect by the end of this lesson, all learners to have achieved all these objectives, okay? So we are going to be going into the details of what hospital economy is, how it is applied in our nursing practice, and lastly, we shall look at the importance or the benefits of this hospital economy. All right. So we are going to start off with our definition. And by definition, economy of the hospital may simply mean to keep the hospital operational costs as low as possible without compromising the quality of services. So as you can see in my definition, we are having these highlighted words. They are keywords to note. Okay, if you're to look at these words that I've highlighted, they bring out the real meaning of what hospital economy is. Okay, so one, what you have to understand in hospital economy, that you are trying your level best to keep the operational costs of the hospital as low as possible. Okay, that's why you're seeing this word, these words highlighted. Operational costs of the hospital have to be kept as low as possible, but without compromising the quality of care. So the quality of care also matters, okay? You shouldn't, for example, you're aiming at keeping the operational costs as low as possible, but in turn, the quality of care you're offering is not that good, okay? So for hospital economy, you have to ensure that the quality of services that you're delivering is good, and also the costs are affordable or are kept as low as possible. So that brings out the whole meaning of what hospital economy is, okay? So it is a responsibility of everybody in the hospital to say that the hospital expenditure is kept very low, okay? So all people in the hospital, including the nurses, the midwives, the doctors, all health workers, have to work hand in hand to make sure that the hospital expenditure is very low and without compromising the quality of services, okay? Yes. So that is the definition. Hopefully all of you have got it so well. So next we are going to look at the aim of hospital economy. So what could be the aim of this hospital economy that we are trying to talk about? So simply, the aim of hospital economy is to be able to keep the hospital operational costs as low as possible without compromising the quality of services. So that is the major aim of hospital economy. We want to make sure that we are delivering quality services to our clients, but at an affordable price. Okay, so that is the major aim of hospital economy. So next on our objectives, we saw that we have to look at how this hospital economy is applied in our nursing practice. So we are going to look at the application of hospital economy in the nursing practice. Okay. Yes, so hospital economy nursing practice involves understanding and applying of economic principles to optimize healthcare delivery, to improve patients' outcomes, and manage resources effectively. So as we are going to dive into the details of how we can apply this hospital economy we are talking about in our nursing practice, what you have to know that this hospital economy involves understanding. You have to be able to understand and apply the economic principles. So the economic principles, we are going to look at them in details, okay? And we are going to appreciate, we are going to understand how we can apply those different economic principles, but with the major aim of optimizing healthcare delivery, improving patients' outcome, and also managing resources effectively. Okay? Yes. So, below are the economic principles that you need to appreciate, that you need to understand and apply. Okay? One of the economic principles, we have what we call resource management. Okay? So in resource management, what are we going to be looking at in resource management? We are going to appreciate that, okay? As we saw in this first paragraph here, that we have to be able, one, to understand and apply the economic principles that we are going to talk about, but our major aim of applying and understanding those economic principles are: we want to make sure that we improve the patient's outcomes. We want to make sure that we are managing resources effectively. And we want to sure that we are optimizing healthcare delivery. So we have started with resource management. So under resource management, we have what we call equipment management. We are going to be looking at the different ways how we can manage our resources at the facilities effectively and efficiently. So one is equipment management. We know very well that at our facilities that we are going to be operating in, we have different equipments that we shall be using in those facilities. So, nurses should contribute to the efficient use and maintenance of medical equipment, ensuring its availability and minimizing downtime time. Okay, so what do I mean by this? As I've said that at our facilities, we are going to be having plenty of equipment that we use. So what is our role? How are we applying hospital economy in regards to equipment management? So for equipment management, we have to ensure that we as nurses, all the medical equipments that we are having at our facility are, one, functional. Okay, you might find that you're at a facility, you're having different equipments, but some are faulty. So what do we do under hospital economy? You have to make sure that you report any damage in time, okay? So that you ensure its availability, okay? Because if this equipment is not operated, is not repaired, it is going to be down for a meantime. But remember, all these equipments are essential during our maybe service delivery at the facility. At a certain point, you might need to use these equipments. So we as nurses, we have to make sure that they are all in good conditions. If at all there is an equipment which is not in a good condition, you have to report it to the responsible personnel such that it is worked on in time to minimize its downtime, the time it will spend when it is not working, which will in turn, affect the service delivery or the quality of services to our clients. Because a client will reach, for example, at your facility, You're supposed maybe to take their vitals, but you find that your monitor is down, you're going to end up not taking their vitals. And we know very well, for example, the blood pressure, they are the baselines for all the care and the diagnosis these people will be getting. So if at all your monitor is not working, what will happen? You're going to end up sending this person, the client, maybe to another, or you're going to end up running up and down to borrow the equipment from other wards. So it will be interrupting your services. So as we are at our facilities, you have to make sure that you have all the necessary equipment that you need at your facility. You have to make sure that you maintain them in a good working condition, okay? As you're using them, make sure that you handle them with care. And again, if at all the equipment happen to be faulty, do the needful, report to the responsible personnel, and make sure that it is repaired in time, okay? So that is one point under resource management. You have to make sure that you manage your equipment effectively at your wards or at your facilities that will be on. Next, still under resource management, we have what we call efficient staffing. What do I mean by this? Nurses should help determine we as nurses, we should help to determine the optimal level or the optimal staffing levels based on the patient's needs, acuity, and availability of resources, ensuring appropriate care while minimizing costs. So, we nurses, we can also help in the efficient staffing. How? For example, you are at a facility doing what you're supposed to do. It is easy for you, a nurse on that department, to identify the gaps or how many people you might need at that facility to help you out with the work, depending on the patient's needs, the acuity, and also availability of resources. Because you might find that at a facility you need more, for example, more manpower. Okay, when you can't handle all what you're supposed to handle in that department alone. So you're going to come up with suggestions to maybe a responsible personnel or to the administration that you need a certain number of staff to help you at your department. Okay? When you have seen the patient's needs at that department, and you also have to keep it in mind that why are you doing all this? To ensure that there is appropriate care, but still while minimizing the costs, okay? So as you're advocating for more staff, for more help at your department, you have to also look at the available resources, okay? So that is also another way how you can ensure you're managing resources effectively. So you're able to do what we call efficient staffing, depending on the patient's need at your department, the acuity, and the available resources, such that you ensure appropriate care to those patients in your department or at your ward. Next, we have what we call supply utilization. What do I mean by this? Nurses should implement strategies to minimize waste, promote appropriate use of supplies, and to advocate for cost-effective product selection. Still under resource management, we as nurses and midwives, we are supposed to utilize the supplies which are given to us effectively. How? By minimizing waste. For example, if at all they've supplied your department with medicines, make sure you use the medicines appropriately avoid any wastage. Okay, remember our major aim is to make sure that the operational costs of the hospital are kept as low as possible. So as you're handling your supply at your department, make sure you try to minimize wastage of those supplies. Okay, and also promoting appropriate use of supplies. Don't ask for a thing you not use. Okay, as you're making requisitions, you have to make sure that you're only asking for the supplies that are needed for that particular department you're operating in, and also advocating for cost-effective product selection. Okay, so nurses also play a part in advocating for products, good products, but which are at a fair price. To make sure that you keep the expenditure of the hospital low. Okay, because if at all you don't advocate for those cost-effective products, you're going to end up, maybe the hospital will end up buying more expensive things, and in turn the expenditure of the hospital will be high, and at times the clients you're handling can't afford the services because of your costs. So you want to make sure that we are delivering a quality service and at an appropriate or a fair price. Okay, yes, hope we are moving at the same pace. So next, still under the supplies, we have supplies like drugs. So here they are saying that drugs are the most expensive among the operational costs. So health workers should properly handle all medicines and sundries at their facility to avoid any wastage. That one I've already hinted about it. Okay, so we have supplies like drugs. They are really expensive, and they are among the most expensive. They are the ones which contribute to the biggest percentage of the hospital expenditure. So as you are at that facility, at that ward, make sure that you handle all the drugs properly, and also the sundries to avoid any wastage. When I talk of this hospital sundries, I mean things like the NG tubes, the gloves, the syringes. Okay, so those are some of the sundries that I'm talking about. So as you're at a ward, for example, you'll be student nurses and midwives at the wards. So please make sure you use all these at an appropriate time. Not being there, you're not doing any procedure, but you're wearing a glove. For what? That is wastage of sundries. Then we have also other supplies like the dressings. So for the dressings, I'm meaning cotton and gauze. So they are also very expensive items, and they should be used only for a purpose for which they are intended. Okay, so make sure that you're using those dressings for a purpose they are intended for. We don't want to find you on ward, a surgical ward, you're getting our sterile cotton and you're using it to dump dust. That is wastage. That cotton is not indicated for cleaning. Okay, so we also have other supplies like food. So food for hospitals that feed patients is ordered according to the number of patients on ward to avoid excess. Okay, so as you're on wards, for example, especially for the hospitals that feed patients, because we have some hospitals which don't feed patients, where the caretakers are responsible for the feeding or for the food of their clients. But for hospitals that provide food for the clients, that food is also ordered according to the number of patients. Why? We want to avoid any excess, because if we get that excess, we are going to end up wasting it. Okay, yet our main aim is to reduce all those wastes, and in turn reducing the operational costs for the hospital. So unused food is returned to the kitchen in case, for example, they brought food for that number of patients in the ward and they've served the food. Probably the patients have not eaten so much and some food has remained in the dishes unserved. It is supposed to be taken back to the kitchen. Then food left by patients must be discarded. For the leftovers, for that food that will be left by patients on their plates after feeding some, that one is not taken back to the kitchen, but instead it is discarded. Then we also have another supply of water and electricity. So for water or electricity, what are you supposed to do as nurses in regards to hospital economy? One, you have to switch off lights after use. If you're in a department, if you're in a ward, you're done using that light, make sure you leave it off. Do not leave water running after use. For example, you're done with your hand hygiene using that running water on the tap. Please and please, never leave that water running after use. Make sure you close that tap. Okay? So, also when a light fuses, the nurse should report it immediately for replace. Remember we talked of the other point of equipment management, where you're supposed to report any damages. So same applies to the lights. If at all you've seen a light that has fused, report it immediately such that it is replaced. Okay? Yes. So next, we are going to look at quality improvement and cost reduction. So previously, we've been looking at the economic principle known as resource management. Okay, so maybe let me first take you back. A little bit for a simple recap. So remember, we are looking at the economic principles. We have to understand that we are going to put into practice as nurses. And one of the economic principles is resource management. And under resource management, we have looked at equipment management, efficient staffing, supply utilization. Okay? So our next principle is quality improvement and cost reduction. So what are we going to look at under here? One, one is evidence-based practice. So here, nurses should utilize research findings to implement evidence-based practices that improve patient outcomes while potentially reducing costs associated with complications or readmissions. So, under this principle, we are looking at one, evidence-based practice. So what do we mean by this? That here, nurses have to utilize the research findings to implement evidence-based practices. For example, they've made a research about malaria, and they have come up with evidence that immunization can really help to reduce on the malaria cases in children. So we as nurses, we have to utilize those research findings and implement the practices. So here the practice will be immunization. So we are responsible to implement the immunization practice in regards to malaria prevention, such that we improve the patient's outcomes. And indeed it will improve. How? For example, the child has gotten all the doses of malaria, meaning that there are high chances of this child not suffering from malaria. Okay, so in turn we are reducing the costs associated with the complications of malaria, because if a child doesn't fall sick of malaria, meaning there will not be any cost for hospitalization and the related complications of malaria or the readmissions. So that is what we mean by the evidence-based practice. In turn, we are improving the quality of care of our clients, and also the cost has reduced, because this mother or this caretaker will not have to incur any costs in regards to malaria treatment. Why? Because this child was immunized and the child has not fallen sick of malaria. Next is preventive care. So in preventive care, nurses can play a crucial role in promoting preventive care measures such as vaccination and health education, which can reduce the incidence of the costly illnesses. This is also a very good point if you are to look at it. So we as nurses, you have to always promote preventive care measures. Prevent that illness before it happens. How? One, you can do health education talks. For example, you're going to health educate mothers on diet, on how to feed their children. In turn, you're going to be preventing illnesses like malnutrition of their children, which might incur costly services. Then we also have other preventive measures like vaccination. That one I've already talked about it. You have vaccinated those children against those different kinds of diseases, of illnesses, meaning that these children are having a very low risk of suffering from those illnesses, and in turn you're increasing the incidence of those costly illnesses. So that's improving the quality of care of our children and also the adults. The last point here is care coordination. So nurses can facilitate smooth transitions of care, reducing these delays and potential complications, which can translate the cost savings. Okay, so if at all we observe all that, in turn we are going to reduce potential complications that might be related to those illnesses, which might bring about those costly services. So in turn, even the individuals, even the clients we are working on are translating a cost saving. They are saving a lot of the money they would have used for management of their illnesses. Why? Because we have, as nurses and midwives, we have played our role. We have implemented the evidence-based practices. We have done the preventive care measures. We have health educated. We have vaccinated, okay, and all that. Then next, we are going to look at patient safety and outcomes in regard to hospital economy. So this is our third economic principle. Our first one, I re-echo it, it was resource management. Then our second one was quality improvement. It was quality improvement and cost reduction. So our third principle is patient safety and outcomes. So under this, we are going to look at medication management. So for medication management, nurses should ensure accurate medication administration, minimizing error and adverse drug effects which can lead to costly complications. Optimizing patient flow and discharge planning to minimize hospital stays. Okay. So under medication management, we as nurses, we have to always ensure that we are offering correct medicine administration. Remember, we saw these medicines or the drugs under resources or under the supplies, okay, that we should handle them appropriately to avoid any wastage. So that in turn is reducing the expenditure of the hospital costs. But still, it is, for example, if you ensure accurate medicine administration, we are also keeping the patient safe. Because if at all you don't ensure accurate medication, you end up giving a patient an overdose or a drug which is not correct, indicated for their conditions, which might even worsen their condition. And in turn, when the patient's condition worsens, even the costs for management will also increase. But if we ensure accurate medication, meaning that the patient will be safe and their outcomes will be good. Yes, then the other thing still under that, we have optimizing patient flow and discharge planning to minimize hospital stays. So we shall look at the details of discharge planning when we come to our topic of patient discharging of patients. But in regards to hospital economy, we have to also make sure that we follow up the patient as we are monitoring them, and we plan for discharge as early as possible to minimize hospital stays. Remember, these hospital stays are going to come up with increased costs. The more this patient is delaying in the hospital, the more they will continue spending on different things like food and all that. So we have to, as we are monitoring our patients, the moment they stabilize, we start planning for discharge. Next, still under patient safety, we have fall prevention. So nurses should implement fall prevention protocols, reducing the risk of falls and associated injuries, which can be costly in terms of treatment and prolonged hospital stays. If at all you have noticed a patient at a risk of falls, for example, the epileptic patients, make sure you implement the protocol, the fall prevention protocols. Make sure the bed you're putting in this patient is having the side rails and they are raised and fixed, okay, to prevent such incidences, which in turn will lead to falls and also associated injuries, and in turn they will be keeping this patient more in the hospital. And the more they stay in the hospital, the more they incur costs. And don't forget that our aim for hospital economy, we want to make sure that the hospital costs are kept as low as possible. Then we have infection control. So nurses can play a vital role in infection control, reducing the incidences of hospital-acquired infections, which can be costly and potentially life-threatening. That one is self-explained. So we as nurses, we play a vital role in infection prevention and control, as we shall look at it in details. So in turn, you're reducing the incidences of acquisition of infections, which can be costly and life-threatening. So next, our last principle is cost effectiveness analysis. Okay, so how does cost effectiveness analysis play a part in regards to the nursing, in regards to hospital economy? So under this, we have what we call economic evaluation. So nurses can participate in cost effectiveness analysis, evaluate the economic impact of different evidence-based interventions, and make informed decisions about resource allocations. Okay. So under this principle, we want to look at how best can we allocate resources. Okay. So we as nurses, we have to participate in those cost effectiveness analysis. Okay. Such that, for example, when we have implemented the evidence-based practices, those interventions, the ones we've talked about previously, the vaccination, okay, so we have to follow up, and we make those analyses such that we are able to make informed decisions that according to what we had implemented, we need such and such resources. We need these and these resources. So if at all we participate in those cost effectiveness analysis, we are able to make informed decisions about the resource allocations. We shall know which resources we need in our departments, we as nurses. Okay, and in turn we are saving, or we are reducing those costly, the expenditure that the hospital would have incurred if it wasn't for those interventions. So in essence, hospital economy provides a framework for understanding how resources are allocated. That is what I've been talking about. Hospital economy provides a framework for understanding how resources are allocated within the healthcare systems and how nurses can contribute to both financial and clinical success of healthcare organizations. So if we apply all these that we've seen above, we are going to be contributing to financial success of the hospital and also the clinical success, because we are not going to compromise the quality of care that we are going to be offering. No compromising the quality of care, but cost effective. So by understanding these principles, nurses can become more effective advocates for their patients and their profession. So we have to make sure that we understand the principles, the economic principles that I've shared with you. And that's why I'm making these recaps. So below are the economic principles that we've looked at. One was resource management. Okay. Two, let me first go back a little bit. One, we looked at resource management. We also looked at quality improvement and cost reduction. That was our second principle. Then we looked at patient safety and outcomes. And lastly, we've looked at the cost effectiveness analysis. So by understanding all those principles, nurses can become more effective advocates for their patients and also their profession. So we are going to proceed to our last objective of hospital economy, and that one is the importance of hospital economy. So you can also brainstorm and think of, according to what we have covered, you can think of what importance this hospital economy could be. So whatever you have thought about, just add on what I'll be giving you. So one of the importance of hospital economy is it improves patient outcomes. So by making those informed decisions about resource allocations and care delivery, nurses contribute to better patient outcomes such as reduced hospital readmissions and improve the recovery rates. Okay, we've looked at all these. By doing that cost effectiveness analysis, we are evaluating the implemented evidence-based practices, for example, immunization. And by doing all that, we as nurses can come up with better outcomes such as reduced readmissions. If at all such implementations are put in place, we expect the number of people suffering from those vaccinated illnesses to reduce, and also to improve on the recovery rates of those illnesses. Two, it also brings about an enhanced cost effectiveness. So understanding the economic aspects of healthcare can help nurses identify and implement the cost-saving measures without compromising patients' care. That one, we've been emphasizing about it so much. As we are planning to implement those cost-saving measures, we shouldn't compromise the patient's care. Next, we have increased efficiency. So here efficient resource management and optimized care pathways can lead to increased efficiency in healthcare delivery. So here, remember, we looked at a lot. In resource management, we saw staffing, okay, efficient staffing. So by doing all that in hospital economy, we are going to come up with a well-organized healthcare delivery. Then we also have better decision making. Economic principles can guide nurses in making informed decisions about staffing resource, about resource allocation, and selection of appropriate interventions. We've seen that. That as we are applying these different hospital economy, the principles, for example, the resource management, we are going to be looking at staffing resource. We can allocate appropriate staff that we need per department, okay, and also the resources we might need according to the interventions we are to offer to our clients. So we come up with better decision making. Then we have patient advocacy. So understanding healthcare economics empowers nurses to advocate for their patients, ensuring they receive the necessary care while considering the financial implications for the patient and the healthcare system. We've seen that so well. They can do research and then they come up with evidence-based practices, which in turn will help their patients. Okay, and by helping their patients to improve on their health, they are also cost friendly. Then we also have staffing ratio. Staffing ratios, budget constraints often lead to understaffing. Okay, so yes, that is very true. Budget constraints often lead to understaffing. because of issues of money. So impacting nurse workload and patient safety. So if a nurse is overwhelmed, one nurse is supposed to handle a whole unit. This nurse is going to be overwhelmed and patient safety will be compromised at a certain level too. So nurses with economic knowledge can advocate for appropriate staffing level based on the patient acuity and resource availability. That one we've seen it. So if at all nurses are equipped with this knowledge of hospital economy, they are able to advocate for appropriate staffing levels because we've seen the benefits of all these. We want to minimize errors and also workload. Next, we have promotion of preventive care. We've seen that under patient's care in hospital economy. So economic consideration can influence the promotion of preventive care services, potentially reducing the need for more costly interventions later. And we know very well that prevention is better than cure. So it will reduce the need for more costly interventions if at all the illness has not happened. We also have resource management. Understanding supply chain management, inventory control, and cost-effective practices ensures efficient utilization of these resources and minimizing waste and also optimizing patient care delivery. We have another point can be greater accountability. How? By understanding the economic implications and their actions, nurses can become more accountable for their decisions and their impact on the healthcare system. We have improved patient safety. We also saw that in hospital economy, much as we are trying to minimize the wastage of, for example, medicines, we should also ensure accuracy as we are administering these medicines to make sure that we are giving the right medicine to the right patient and in right doses, and in turn improving the patient safety. Then health economics in nursing curricula. So how is this hospital economy of importance in our nursing curricula? So incorporating these health economics into the nursing education is also crucial in equipping our future nurses with the necessary knowledge on hospital economy. So we are here in this lesson studying about hospital economy. It is going to help you as future nurses and midwives, as you are on those departments, as you are in the wards, wherever you will be. You'll be knowledgeable of how to manage resources effectively. You'll be knowledgeable of how to advocate for cost-effective measures. You'll be knowledgeable of how to promote preventive measures. You will be knowledgeable of which importance are the evidence-based interventions to our clients and to the hospital administration too. We've seen that it is going to prevent occurrence of those illnesses, and it will be cost-friendly, because if at all that client has not suffered from that illness because of you, in turn they will not incur the cost they will have put in if at all they had fallen sick for those illnesses. So lastly, in conclusion, a strong understanding of hospital economy is essential for nurses to navigate the complexities of the healthcare system, to optimize patient care as we've seen, and to contribute to more sustainable and efficient healthcare environment. Okay, So in summary, we have looked at what hospital economy is, and we've seen that it is majorly keeping the operational costs of the hospital as low as possible, but without compromising care. Then we have also looked at how it is applied in our nursing practice. So application of hospital economy in our nursing practice, we've seen that it is important for we nurses and midwives to understand the economic principles in regard to hospital economy. So we have gone ahead and looked at those economic principles where we've seen resource management, we've seen quality improvement, we've seen patient safety, and we've seen cost effectiveness analysis in details. Lastly, we have seen the importance of this hospital economy to our nursing practice still. And we've looked at a number of points where we've seen there is patient safety, number one, there is quality improvement, and all that we've seen. So I want to appreciate you for paying attention during this session. So in case you have any concern and questions, I'll be welcoming them and I'll be there to answer them. Thank you so much for your attention. So I beg that we put all that we've seen in practice, okay? But keeping it in mind, you're not compromising the quality of service to our clients, but all the services you're offering are cost friendly and you're keeping the hospital operational costs as low as possible. Thank you so much.